Senator Blunt Rochester.
Thank you, Chairman Cassidy and Ranking Member Sanders. Mr. Kennedy, during our meeting, you shared your vision for the department, and we discussed priorities important to my home state of Delaware. But I must say, as a former cabinet secretary and a health official in my state, and listening to your answers today in this hearing, I am deeply concerned and shocked by your apparent lack of understanding of, frankly, some of the basic responsibilities of the department. It's one of the largest, most complex, and it is vitally important. And yesterday, during your finance hearing, and today, you confused details about Medicare and Medicaid. You didn't know what authorities you have under the Emergency Medical Treatment and Labor Act, known as EMTALA, and you made false claims about the safety of mifepristone. However, what concerns me the most as a mom and a first-time grandmother is your decades-long track record of promoting vaccine misinformation and profiting from it, despite the harms that it may cause to American children. And with that, I'll turn to my questions. In yesterday's hearing, you did not seem to know anything about EMTALA, even though I raised it with you during our meeting last week. So I'll give you another opportunity. Yes or no, do you believe that a person presenting to an emergency room with a severe illness should have any type of emergency care needed to save their life?
Any American who the
Yes
law
or no?
says.
Yes.
I'm answering the question. Any
Yes
American,
or no was the direction.
under the law, every American who presents to an emergency room must be treated, and I enforce that law, and I believe that's the right thing to do.
Do you agree that a person who is experiencing severe pregnancy complications should be able to receive emergency care to save their life if that care is an abortion?
My understanding of President Trump's policy is that
I'm not asking
women,
you President Trump's policy. I'm asking you, what do you believe?
If it's necessary to save the life of the mother.
Okay, so you
of
do
course,
believe,
yes.
yes, they should. Do you commit to ensuring that pregnant women will have access to all necessary emergency care, including an abortion, if it is required to save their life or preserve
If it's required to save their life.
And would you agree that the ability to provide quality emergency care for pregnant women is essential to preventing maternal mortality?
Providing care for pregnant women, we should be providing care for pregnant women. President Trump wants to do that.
Bottom line for me, women should not be forced to rely on emergency airlifts to other states for life-saving care. And to be blunt, in our meeting, your lack of understanding really, again, was very concerning. In a 2023 interview, you described yourself saying, "I'm a Kennedy Democrat. I believe in labor unions. I believe in a strong, robust middle class. I believe in racial justice." And just yesterday and today, during this hearing and the hearing yesterday, you said we need to respect diversity. Mr. Kennedy, the Trump administration recently issued an executive order that directs the federal government to eliminate grants, contracts, policies, programs, and activities that include diversity, equity, inclusion, and accessibility. This executive order has already caused widespread confusion, fear, and uncertainty for healthcare providers, researchers, public health professionals, and service providers across the country. You said in our meeting that you understand that health disparities exist. So yes or no, do you, in your view, do the following programs count as health DEI programs? Programs that target Black women to address the maternal mortality crisis?
Senator, there are 7.
Yes or no?
I'm not going to answer that yes or no. If you want an answer, I'm happy to give it to you, but it's not a yes or no.
I just want a yes or no.
It's not susceptible to yes or no answer.
Well,
if you want to hear an answer, Senator.
Let me shift this, because I only have 36.
If you want to hear an answer, Senator, I'm very happy to give you one.
I've got now 33 seconds. And there are people out here who want to understand that if they are at a pride parade and they're a healthcare provider, can they give out a brochure?
If you want people to understand, let me answer the question. If they are trying to have a program
in a Black church that is on Martin Luther King Day, will they be able to have that program? Will it be funded? Will they get in trouble? Will they be fired? That's the cause and concern. We all know that it is important that we have a healthy country. But
want me
as
to
you
answer the
said,
question,
health
Senator?
I think I got my answer.
Okay.
Thank you, and I yield back.
I will
Thank
allow
you.
the witness to answer.
There are 7 departments at NIH that protect minority health and that seek to eliminate the shocking and unacceptable disparities in minority health. I believe in helping all people who are vulnerable. The DEI programs that President Trump eliminated have spent $63 million with no discernible positive impact on human health in this country. There's institutions already that existed before President Biden, whose job it is to do just that.
Will you cut those programs that you just referenced?
That decision is up to Congress, not to the HHS Secretary.
Thank you. I yield back.
For the record, treating a miscarriage or ectopic pregnancy is not an abortion. It's just false. And so I would ask that not be, since I'm not into misinformation, I would ask that misinformation not continually be repeated.